mission of research, teaching, and public service. We reached a new milestone of nearly 300,000 students enrolled across the system, and the system remains unparalleled engine for the state of California and for the world through the initiatives and research and education that's happening. Of course, through my own work, I see my colleagues from different fields collaborating, working closely. But through UCDRN, we want to go beyond just our own individual research and basically translate our research to impacts across sectors. Finally, it's been a pleasure to co-host this year-long expert panel on climate and mobility with CCST across all 4 events. We've had, I believe, around 1,500 individuals who signed up and joined and participated, and about, I believe, 600 people or so registered only for today's event across multiple sectors. And we are hoping to continue this collaboration in the future. This was a great start, and we are really excited to continue with CCST on this or similar topics in the future. And of course, special thanks to our collaborators at UC Berkeley Institute for Security and Governance, whose partnership has helped amplify the impacts. With that, I'm delighted to turn things over to today's panel to continue the conversation. Thank you.
Thank you so much, Amir, for those thoughtful introductory remarks. I'd like to also extend my sincere thanks to the dedicated staff at our partner organizations, of course, the UC Disaster Resilience Network and the UC Berkeley Institute for Security and Governance, who've been invaluable collaborators throughout this year. We've been quite inspired. So I'd next like to take a moment to introduce the Berkeley Institute for Security and Governance, BISG, and its new executive director, Angelina Soldados, who unfortunately could not be with us today. Founded and led by former U.S. Secretary of Homeland Security and University of California President Emerita Janet Napolitano, BISG engages in policy development, critical research, and innovation on national security, emerging technologies, and institutional resilience, advancing cross-sector solutions to complex challenges. In addition to this work, BISG also serves as a key operational node for UCDRN across the UC system, facilitating foundational strategic partnerships that to date have included CCST, EY, and the Universidad de Chile, the Association of Pacific Rim Universities, and many more. So I'd now like to introduce our moderator, Doug Parsons. Doug is the founder and host of America Adapts, the climate change podcast, one of the world's leading podcasts dedicated to climate adaptation. Through his podcast, Doug has interviewed hundreds of experts, from top scientists and policymakers to grassroots leaders, elevating critical adaptation conversations to a global audience. Before launching America Adapts, Doug built a career in climate adaptation, working in Australia on agricultural climate impacts before becoming Florida's first climate change coordinator at the Florida Fish and Wildlife Conservation Commission. He later served as a climate change liaison for the National Park Service and as North America Policy Director at the Society for Conservation Biology. Now, through America Adapts, Doug continues to amplify the voices of those driving adaptation solutions. Definitely check out his podcasts, wherever you listen to podcasts. Thank you so much for moderating this year's webinar on climate change and human mobility. Doug, over to you.
All right. Thank you, Julianne. And thanks for the organizers for having me for a 4th time. It's such a treat and honor to be here as the moderator with all these all-stars that you recruit for each of these. And so thanks to the audience for joining us today. Yes, definitely check out the podcast. I think they shared a link there. So we have an exceptional panel of experts today that will examine how communities and local and regional governments in California are addressing the growing challenge of climate-induced human mobility and share best practices for building resilience across sectors. These sectors include expanding healthcare access for climate migrants, leveraging data systems to anticipate migration patterns and coordinate resources, and developing adaptive infrastructure that balances immediate needs with long-term sustainability. We will cover a lot of ground today. Hopefully that's the only bit of script that I stick to there. All right, we're going to start off. I'm going to introduce you to these panelists. I'm going to just introduce them in this order, and they're going to kind of come back to me, and then we're going to jump to those questions. I'm going to probably repeat this. There's a Q&A tool here on Zoom, and please just start asking questions. I'm going to do my best We obviously are not going to get to them all and not even necessarily the right order. We're kind of going to see where they kind of fit in, but let's just get started first. I'm going to just do a brief introduction and they're going to give a little bit more background and they're going to bring it back to me. Okay, Dr. Michael Mendez is an associate professor at the University of California, Irvine. Hey, Mike. All right.
Good afternoon. I can't start my video, unfortunately, but I'm Michael Mendez. I'm an associate professor at the University of California, Irvine, and my research looks at the intersection between climate disasters or climate-induced disasters, climate change, and environmental justice, particularly looking at how some communities are consistently considered socially vulnerable or suffering from the disproportionate impacts of climate-induced disasters, particularly undocumented migrants and undocumented farm workers. So I've been working the last several years with NGOs, civil society groups to uncover some of these issues that have made this community one of the most hyper-marginalized and stigmatized populations when it comes to disasters. Thank you. I look forward to our conversation.
All right, thanks, Mike. And Mike has been on my podcast a couple times. It's a treat to see him here. Okay, our next expert is Dr. Ali Mostafavi. He's a professor of civil and environmental engineering at Texas A&M University. Ali.
Thank you, Doug, and good afternoon, everyone. My name is Ali Mostafavi. I'm a professor of civil engineering at Texas A&M, and I'm also the director of Disaster AI Initiative within the Texas Institute for Disaster Resilient Texas. My research focuses at the intersection of disasters, community systems, and data and artificial intelligence, where we leverage various data sets related to infrastructure networks, human activities, and human mobility, and also hazard characteristics to better understand, characterize, and predict this intersection between hazards, human, and infrastructure systems within communities. And I'm really looking forward to this conversation.
All right, thank you, Ali. Next up is Dr. Sherry Weiser, professor of medicine and an internist at the University of California, San Francisco. Hey, Sherry.
Hello. So I'm a professor in the Division of HIV, Infectious Diseases, and Global Medicine at UCSF. I also co-found and co-direct the University of California Center on Climate, the UC Center on Climate, Health, and Equity, and Eco Health Centers, where we're working to expand climate and health research, education, policy, and clinical initiatives. And importantly, I'm also the UCSF DRN lead. So my research over the past 25 years focuses on the impact of food insecurity, extreme weather, and other social and structural factors on treatment outcomes for HIV and chronic disease. And I also evaluate sustainable food insecurity and livelihood interventions as a way to improve health. And as an internist, I've been working with vulnerable populations at a safety net hospital in San Francisco since 2001. Thank you.
All right, thank you, Sherry. And next up is Primitiva Hernandez, who's the executive director of 805 UndocuFund. Hey, Primitiva.
Hello, everyone. Pleasure being here. Primitiva Hernandez, executive director with 805 UndocuFund. And our organization operates in the Central Coast of California, serving this huge area code. That's why 805. We take great pride in serving the 805 area. And our nonprofit was started as a project back in 2018, serving the undocumented immigrant mixed status communities due to their disproportionate impacts from climate-induced disaster, the Thomas wildfire, Montecito mudslides that made national headlines, the global pandemic. And we serve as an organization. We exist because undocumented mixed status households are systemically excluded from disaster aid, emergency response, public safety systems. We've distributed over $9 million in the last 7 years that we've been operating. And we also co-lead with the UndocuFund in Sonoma County, the California UndocuFund network, which is comprised of many other undocumented funds or organizations that activate during disasters and serve the undocumented mixed status community in the state of California. And a pleasure being here today. Looking forward to the conversations.
All right, thanks everyone. If Mike, we can get you to get your video. Let's get us all here showing ourselves. No, and Primitiva, you can come back on. We're gonna keep everybody so we can see, even if you want to mute yourself. All right, I'm gonna start off with you, Sherry. We've got to cover a lot of ground here, and again, I want to remind the audience that there's a Q&A section. Put it in there. Might not get through all those questions, but we actually will share those with panelists. Maybe there's an opportunity to answer those at a later time. But Sherry, let's start off. What are the most common health challenges you see when climate impacts force people to move? And where do the systems fall short in all this?
Yeah, that's a great question. So first, there's health effects. You see many different health effects in different categories. So first, you see more infectious disease risk. So infectious disease outbreaks are very common, particularly in crowded settlements and refugee camps. We know that migration is also expanding sexual networks and can increase exposure to gender-based violence, particularly for women. So women are particularly vulnerable, and this can raise risk of exposure to HIV and other sexually transmitted infections. A second area is really maternal, child, and reproductive health. And that is very, very vulnerable during climate-related migration. So pregnant people, infants, and young children are very sensitive to both heat exposure and infectious disease risk. And then gaps in preventive care during and after migration can be particularly problematic for this group. So you see more interruptions in prenatal and postnatal care and access to contraceptions. A third thing is that climate-related migration is triggering or worsening chronic disease because of changes in diet, physical activity, worse access to healthcare, and the stress of displacement, which then can contribute to either new or worsening chronic diseases. This is particularly true for cardiometabolic conditions. And then I would say related to this, you see profound impacts on nutrition. So disruptions in our livelihood and food systems and social supports can increase risk of food insecurity and malnutrition. And I would say a common thread across all these pathways is reduced ability to engage in care. So it's much harder to maintain stable relationships with health systems providers and medications when you're moving around. And then when those medication access and healthcare is interrupted, it's very hard to manage your chronic conditions. And finally, I will say there's really important mental health effects, but I'm going to save that for a different question in the interest of time and to let other people speak.
And also, we talked about this before, but I want to encourage my panel. If you have a follow-up question from one of the guests, please do. I have about 6 follow-up questions for Sherry, but I'm not going to do that. I'm going to kind of control myself. We're going to keep this going. But Mike, I'm going to jump over to you. So from your experiences responding to wildfires, floods, and extreme heat on the Central Coast, how does climate-driven displacement uniquely impact undocumented and mixed status families? And then what do you see as gaps in that response for those folks?
Sure. Thank you for that question. I think this is an important avenue to talk about those issues, some of the most stigmatized and marginalized populations in the state of California. Oftentimes when we talk about climate change impacts or climate-induced disasters, it's often in abstract terms without the real faces or communities that are being most disproportionately hit by these disasters. So the work that I've been doing has been very community engaged, community focused, working with NGOs like 805 Undocu Fund, Cause, and Mixteco Indígena Community Organizing Project to really understand what is happening on the ground, moving away from those detached ivory tower abstract understandings of disaster that homogenizes all populations without looking at some of these inequities that exist before disaster. In my research, I often like to highlight that undocumented migrants, particularly Indigenous and Latino undocumented migrants, have a pre-disaster marginalized status, really building off of the social political determinants of health, acknowledging that before disaster, before any type of crisis, there's immense disparity in terms of economic mobility, education, language access to health care and what the like. And as a disaster, like a wildfire, extreme storm, heat wave, or drought only exacerbates those symptoms and conditions for undocumented migrants, in essence, creating this hyper form of marginalization for this population. So in our research, we really want to show that human-centered approach, that human face of what is happening, and link it to data, empirical research, and most importantly, being able to uplift that to policymakers, those individuals, decision makers that are in charge, that are often rendering this population invisible in the context of climate change and disaster policy. So obviously they're not physically invisible. They have been living there for many generations or decades or years, but they're rendered invisible in our various forms and policies. So this inequity that we see isn't by accident or coincidence, but it's because of intentional political choices that have prioritized some lives or communities over others. And unfortunately, over the years, and particularly under this federal administration, that inequity is further being exacerbated.
Primitiva, I want you to weigh in too, just because obviously this is a big question. We're talking about the gaps and just how it impacts the undocumented population. I guess sort of complementing there what Mike said from your organization's perspective.
Yes, absolutely. Expanding onto what Professor Mendez just alluded to, is what we're dealing here is it's a global issue, and it's the way we respond as a community will have implications for generations to come. We are seeing that on top of what is happening, that is climate-induced disasters. We see the inequities that exist within federal programs such as FEMA. You know, why was 805 UndocuFund created? Was because we had the community, the people had to create their own system to serve their communities that were disproportionately being impacted, and there was no disaster aid for them. There was no emergency relief. The shelters that usually activate don't take into account this distrust in the system that is only going to get worse with how this community is being persecuted by the administration. The new role that FEMA employees will take in immigration enforcement, it's a huge disservice and unjust way of this specific community sector who serves such a critical role, specifically when we speak about the economy in California. You know, we say that California was built on the back of immigrants from all over the world who are disproportionately being impacted by global warming, and the U.S. is a huge contributor, playing a huge factor in why these communities are coming here. So I think this is the challenge that we're presented with. And here we have researchers, we have academia, that if anything, we come out of this conversation figuring out how we are able to mitigate some of those issues that our communities are dealing with, how we respond, because we're all connected. We're all part of this planet, and we need to figure out how to move together as a society, or there won't be a planet to defend or to figure out how we coexist. So those are broader, I think, ideas, but they're very, very specific to what the undocumented community, regardless of where they're coming from, is experiencing. California having a huge immigrant and migrant population due to its labor needs for agriculture. Here in the Central Coast, we have indigenous migrant peoples who have been coming for many years, who are the backbone of the agriculture industry. And that's going to have ripple effects on the food industry, right? The production and it's all interconnected, and we need to come to terms that something needs to be done, because the system that is built is working for those that it was built to, but it's not serving the most vulnerable, and that's why 805 Andaki Fund was created. That's why we've been able to distribute over $8 million that would have not been in the hands of our people if organizations like ours didn't exist.
All right, thanks for that. And so I'm going to pivot here a bit. Ali, you're listening to some of these answers, and we're thinking about some of the tools that might play a role in all of this. And so, with your work, how can AI and the network model tools being developed at your urban resilience lab be adopted to anticipate human mobility patterns? Following these extreme events, and it can support planning. You're hearing like, okay, there needs to be this kind of planning, and I guess in the context of California too. How can these tools that you're in the thick of here help with all this?
Absolutely. So there are a couple of ideas here. So first of all, I think I would like to first talk about the availability of data sets. So with the growing the diffusion of technologies and use of telecommunication devices, now we have unique data sets that can be used for understanding the movement patterns of communities before, during, and after disasters. So one of the core issues that we can uncover is usually these disproportionate impacts and vulnerabilities that my esteemed colleague talked about goes unnoticed during a disaster until a few years after, and when the impacts have their effects and ripple effects, and it's hard to reverse those impacts at that time. But with these kind of data sets, we can evaluate and monitor the movement patterns and migration, evacuation patterns, whether communities that evacuate return or not in near real time, so that it can be used for understanding the disproportionate impacts of disasters on communities ahead of time. More proactively. That's the first idea. So in terms of the tools, there are various tools that are available that are powered by big data sets and also artificial intelligence. And I would like to emphasize here, when we talk about artificial intelligence in this panel, on my end, it's not just the chatbots and the large language models that all of us use. It's beyond that. There are a class of artificial intelligence tools that are called generative models. However, there are other categories for analytical analysis and predictive analytics that enable us have predictions, evaluation, and characterizations by digesting large amount of data. So in terms of when it comes to disasters like floods and wildfires, we can leverage these tools for monitoring and predicting, for example, evacuation patterns. And we have done that in the past. We have in the context of the state of California, when the Los Angeles fire happened, we were monitoring the evacuation patterns at neighborhood levels to identify the communities that have low evacuation rates, when they evacuated, how far they went, how long did it take for communities to come back. And these models and these data sets provide us with near real-time insights, so that we understand that, hey, this community, when they evacuated for wildfire, it takes longer for them to return. So what's the reason, and what are the resources that they might need to return and rebuild their homes, etc., rather than waiting for months, weeks, months, and years, and then finding out that certain communities are recovering slower, and then learning from these events and what happens on the ground to inform future planning, and also train models so that we can predict the movement patterns, evacuation patterns, access to facilities, access to health facilities, for example, for future events. So, for example, when Los Angeles fire happened, we were able to look into elevated visits to health facilities due to the smoke and public health effects of wildfires, and identify which areas had a surge in visitation population to health facilities. And this is tremendous information that can be used for future planning to identify where burden to access to healthcare exists, and plans are put into effect. And then when disaster happens, these can be monitored in real time. And these are capabilities, just examples that can change the way we understand the impacts of disasters and hazards on communities, and can reduce the impacts.
All right, thanks for that. And Sherry, I'm going to go back to you, and you had alluded to that. We'll talk about it. We're going to talk about it right now. We're talking about mental health effects and on climate migration. And I want you also to address too, because this is a thing, especially if you're in the environmental communities, there's climate grief, there's climate trauma. And I always see those as kind of a separate thing, maybe than the mental health impacts of people that are being like, there's a disaster response. And if you could maybe clarify the difference between those two.
Definitely. So first, let me talk about the sort of direct impacts, mental health impacts of climate-related migration, separate from sort of climate anxiety and climate grief. So when people lose their homes and livelihoods and communities due to climate disasters, we know that relocation is very destabilizing. So it's disrupting people's social networks, their cultural identity, and importantly, their economic security, these are all major drivers of psychological distress. And for many communities, such as Indigenous communities, the loss of land in itself also means loss of identity and history, and that has very serious mental health consequences. So as a result of this, research consistently shows that climate-related displacement is associated with a host of mental health problems following forced migration. So this includes depression, anxiety, sleep disorders, and post-traumatic stress disorders. And it's worse for certain groups, so people who face prolonged uncertainty. And this was shown following hurricanes Katrina and Harvey. Well, they do worse. And people who have repeated moves and repeated displacement due to ongoing risks, like if you have recurrent flooding and recurrent wildfires, well, this then compounds the trauma and makes recovery more difficult. And I think this was already touched upon by one of the other panelists, but in receiving communities, well, migrants can often experience stigma and isolation, and then that further worsens depression and anxiety. Children and adolescents are especially vulnerable. So displacement has been linked to behavioral problems, academic problems, and long-term mental health challenges. And I just want to go back to the point people were raising about disproportionately impacted populations. Also, people of color, people who are lower income, and older people, and people with physical disabilities experience both more physical and mental health impacts following climate-related migration due to really pre-existing inequities that make them more vulnerable, as has been discussed. And then access to mental health service is a critical bottleneck. So, for instance, after I think it was the 2007 California wildfires, about half of households that needed mental health support were unable to get the support they need. So that's addressing the first part of your question. People who are experiencing and exposed to chronic climate stressors, as we are in California, there's a very high prevalence of climate-related anxiety and climate grief. And there's even measures, and we're measuring this in our studies. A very large proportion of young people today are experiencing so much climate anxiety, enough to disrupt their daily lives, and many young people are deciding not to have children as a result. One of the things, so I think it's that chronic climate anxiety surrounding both displacement experiences and people around who are witnessing it that drive those mental health changes. So after the LA wildfires, we hosted at our center, mental health trainings and resilience support. And we thought it was going to be primarily focused in the LA region, but actually people across California needed that support and training because there was a lot of vicarious trauma and stress related to climate-related anxiety. And the last thing I'll mention is that we have a UC-wide mental health council, and it's now the third year I've been part of the professor teaching this class. We've been having a course focused on climate and mental health resilience, where students learn about and confront their own eco-anxiety, And then we address that through mindfulness. And then they translate their eco-anxiety into activism by getting involved in community related projects. And it's been very effective. And in fact, the course itself led to improvements in mental health for students. So I'll stop there.
That's fantastic. Maybe that's worth a link sharing in the notes there, that with the work that you did there, Sherry. Mike, I'm going to hop over to you. And this, I think, maybe would be somewhat of a tough question, is that you think of climate migration and you have the displaced communities and then you have the receiving communities, and there's different terminologies for these things. But, how can we prevent through our planning, these inequities so that it's not worsening within these different populations? And when I look at that kind of question, and I'm just like, gosh, it's going to get worse. Even, I mean, I guess it's about mitigating, not necessarily like it's it's not going to get better, right? I mean, climate migration isn't necessarily going to lead to better outcomes, or maybe it will.
Sure. But if I can first follow up on what Sherry was mentioning about the mental health situation or trauma that is experienced through disaster, climate-induced disasters, or other types of disaster. As we know, no matter who you are, your socioeconomic background, if you experience a disaster, there is trauma and other mental health stressors. If you, for instance, in the greater Los Angeles fires, if you lost a home in Malibu, or somewhere like Altadena, while they're very different communities, socioeconomically, they did still suffer the mental health issues. But many of them, being homeowners and had other types of resources, for the most part, did have access to mental health services. Not all, but many did. But for the immigrant community, and more importantly, the undocumented immigrant community, don't have access to those coping mechanisms, those services to deal with that trauma. And a paper that I have coming out with my PhD students, Carlo Changa Pizarro, for the Russell Sage Foundation, we look closely at the migrant serving organizations and how they are coping themselves with these disasters. So many of these migrant serving organizations are coming to serve undocumented migrants because government has left them out. From the federal government to state and local government, they had not planned to include them in their emergency planning projects and plans, did not create valuable relationships to reach out to them, to understand what are the needs of these communities. And because of that, these NGOs like 805 Undocufund has had to step in and become de facto emergency managers. While they're not, and many of them throughout the state and throughout the country, including places like North Carolina that experienced Hurricane Helene, they're creating these parallel networks of disaster aid that the Salvation Army, Red Cross, and government should be providing, but they're not trained. And more importantly, they're not trained to handle how they experience secondary or vicarious trauma. So we had a paper to really analyze that and show the toll it has been taking on NGO and the path forward. So that was just, I wanted to add that, is really understanding how are these frontline workers that are not trained to be disaster providers are experiencing mental health trauma as well. But to your question, I kind of answered it within that mental health question. Is I think what we can do ahead of a disaster is local government really needs to acknowledge that these individuals are living in these communities who are the most socially vulnerable. If it's migrants, to the elderly, to children, people that are disabled, they need to get out of their offices, get out of their desks, and go into the community and find out who are those trusted organizations, from faith-based organizations to school coalitions, PTAs, to, of course, migrant serving organizations like 805 Undocufund, and build those trusted relationships, because they are considered leaders and trusted voices. And particularly now, when many people are afraid of their government, we need to rely heavily on organizations that have the faith of the local community. And so that's one avenue, is taking that whole community perspective and bringing in those actors that can reach hard to reach populations.
All right, thanks. All right, bring me to you. I'm going to jump over to you. And I actually am going to go to a question we got from the audience, but this actually we got prior to this event. It's from Rick Fernandez, who's a community member. And do climate migrants end up living in underserved areas and or receiving the same sheltering support that disaster displaced local residents receive? Let me know if you want to repeat that.
I think I understood it. And the answer is no.
Okay.
They don't, right? And that's because there is this huge gap to what Professor Mendez was alluding to. There is this huge misunderstanding. The undocumented mixed status communities, migrant communities, are not a monolith. They are greatly and gravely misunderstood, miscategorized. It was only a couple years ago that California didn't have an alert system in Spanish, let alone in indigenous languages. A lot of indigenous languages that are currently being used as ways to communicate in the state of California are not written. They're verbal languages that have been passed down for thousands of years, and we are doing a huge disservice to our community by not advancing and by not moving forward at the same rate that our populations, our human people are migrating. In terms of government, in terms of the government having these systems in place, shelters, migrant people are not using these. I mean, there's research and papers done on when these shelters are activated, our people are not going there. They're staying in family members' homes, in their cars, anywhere but the government. So a lot of work to be done on how we can move forward as a community, but they're not utilizing these either because they don't trust the government or that they don't qualify them. Anytime you tie someone's immigration status to a service, you're already excluding them from that system.
All right, thanks. Ali, I'm going to get back to you here. And what data sources help you anticipate these migration patterns? And how do you know what data plug into your AI tools? And just when I think of some of the folks that I've worked with, like at doing sea level rise mapping and all that, there's these federal resources that are now somewhat being compromised. And where do you get the data that you kind of plug into the work that you're doing? And are they academically generated? How does that all work?
I think there are various data sources. I think one of the mottos that we are echoing in our research is that we have to leverage various data modalities and different data sources, from remote sensing, satellite imagery, to location-based cell phone activities, to street view imageries that are publicly available, and of course, many of the data sets that is created by the academic community, but also by various technology companies. So there's several technology companies such as Meta and Microsoft that they have AI for Good, Data for Good programs that provide really important data sets related to movements, access, damage assessment, etc., in the aftermath of disasters. And all of these data sets are significantly important for understanding the impacts of disaster. When it comes particularly to the migrations, evacuation, access to facilities, there are different types of data sets. One is location-based data sets that are usually used for marketing purposes. But over the past few years, researchers, including the work of our group, have found a value of leveraging these data sets for understanding human activity and human mobility before, during, and after disasters. And these are very important data sets because we can understand, for example, before a disaster, the patterns of preparedness activities. So we have a paper in which we have analyzed the hurricane preparedness in the state of Texas ahead of the Hurricane Harvey to evaluate which communities are underprepared based on the visitations to grocery stores and identify underprepared communities. I talked about evacuation monitoring, that we can evaluate the evacuation levels of the different areas so that we can identify, hey, this area is in mandatory evacuation and there's 24 hours past the evacuation order, but we don't see an uptake in evacuation in this neighborhood. So this will provide a very timely message in terms of the channels that evacuation orders needs to be communicated, and also evacuation destination destinations, where people are going, where resources can be allocated more effectively during the time. And in the aftermath, we can evaluate the return and also permanent, relocation, that we can understand, which communities are recovering, which communities are not recovering, and people decide to relocate. These again are mainly, all of these data sets are mainly generated by an ecosystem of data producers with of course the data sets that federal government has produced and made available before that. Some of them are currently becoming unavailable, are really important. But I think the emerging data sets are the ones that have the greatest potential and greatest value, that can complement the standard data set that existed before. And those data sets are mainly generated by the academic community and the technology ecosystem around disaster technology.
I'm going to stick with you just for a second here, Ali. So I think of these data sets and these tools that you're coming up with, and you hear an organization like Primitiva's, like, is there a process? Are there federal agencies, state agencies to get these tools that kind of come online into the hands of maybe organizations that could use them? Sometimes they don't even talk to each other. Build it. I've dealt with national labs, produce incredible resources, and a lot of times people have no clue that they're out there with these different tools and things. So how do you kind of bridge that?
Absolutely. Actually, you mentioned a very important gap that currently exists in a number of panels and talks that I had recently. Is that we have tremendous data sets and technologies and AI tools that are already created by a broader community of national labs, academic institutions and centers, and of course private sector, that are very useful for equipping communities with situational awareness, with predictive analytics, etc. However, the gap is the diffusion of these technologies and solutions and capacity building within the NGOs, community-based organizations, to adopt these technologies and being able to use them effectively. And this gap requires mechanism, fundings, and support that is not falling within the resources of the community-based organizations or the technology companies. So there needs to be, a state or federal programs that incentivize both the community-based organizations and, public agencies, as well as the academic community as technology providers, to be able to implement and translate to these tools and operationalize them into the disaster management processes.
All right, great. And Cherry, I'm going to go to you, and I want you to just think of what Ali just said there too, of the tools and resources maybe not getting out there. But I want to start off with this question too, if you want to kind of address both. And where does healthcare access break down most often for people that are displaced or forced to move? And I think of just even when we have our own people who have healthcare, not everybody has healthcare. It's like, all right, you're out of network, silly things like that. And I look at the LA fires and people's, spread out. And how does healthcare access kind of break down in that situation?
Yeah, so I would say there's two major things to think about. One is people's ability to access care, and also the health systems functioning themselves, either in kind of the community where people are migrating from or the communities where people are migrating to. So starting with healthcare infrastructure, we know that extreme weather could damage your hospitals and clinics. It causes power outages, and it also displaces the healthcare workforce. So when facilities shut down, patients are often forced to seek care elsewhere, which then breaks the continuity of care. So we saw this, for instance, during Hurricane Katrina, when a major New York City hospital affiliated with NYU had to temporarily close and then relocate our medically complex patients elsewhere. And that then creates strain on the surrounding systems. Another thing that happens is that climate-related mobility increases healthcare demand in receiving communities. And it's not just that you have more people, but the people that are arriving are sicker because their health issues have been worsened by the exposure, the heat, the wildfire smoke, the flooding, the mental health trauma, and that leads to more emergency department visits and hospitalizations. This is particularly true for people with pre-existing conditions. And then these pressures, importantly, also translate into substantial healthcare costs, which we can't forget. So as an example, the 2019-2020 Australian wildfires actually resulted in about 2 billion additional health dollars being spent. So prevention and being proactive is extremely important to prevent this. Then we're talking about climate migration disrupting preventive care. So this is what you were raising before. Well, people lose insurance, and they also have trouble accessing new healthcare systems, even when they have insurance. And then this leads to gaps in all of their preventive care, their medication access, their cancer screening. They can't really manage their chronic conditions like their diabetes. And this actually, we saw that these interruptions in care were a major cause of excess deaths after Hurricane Maria in Puerto Rico. So even if they've survived the disaster and didn't have any significant impacts, not having access to healthcare can be very deadly. I think a core challenge here is that health systems are really built around stable populations, but health records, insurance, and referral networks don't move with people. So this makes it very hard to maintain and anticipate healthcare needs during displacement. Now, I think there was a second part of your question that I may have missed.
It was just related to Ali and just the tools and resources, how you might be able to tap into those in the work that you do. That the integration between, all right, there's things out there, but maybe organizations and groups are not actually tapping into those things because they're not communicating. They don't even know how to use it. There's actually this expertise that you might even need to know that you need those tools.
Yeah, I mean, the one sort of like a major tool that we're trying to develop is basically one of the things that's just not happening anywhere is health systems are just not prepared for climate-related disasters. We, in fact, did research across hospitals and clinics all around the Bay Area. Most people don't even know where their emergency plans are kept. They don't have protocols in place. They may have protocols, but the doctors and other health providers don't know what they are, and they're not coordinated across systems. So one of the things that we're trying to do in our center is bring together, public health. We're working with the San Francisco Department of Public Health, the clinics, the hospitals, and the communities to create this sort of integrated climate clinical response plan. And so one of the tools that we're trying to develop is a climate-ready patient tool. So we use electronic medical record data, and we combine that with environmental data to help risk stratify those patients who are most vulnerable before and during extreme weather events. We have to do this before, again, being proactive, so we know who to contact. And then we can generate customized patient messaging that could then integrate the clinical recommendations, demographic context, and then locally relevant community resources. So what can they do about it? If you just tell them you're at risk for wildfire smoke or heat, but there's no action that we're recommending, that doesn't really help them. So we want to help patients take proactive action before their conditions worsen. And the final thing I'll just say about that, and I think this was brought up a lot, about really working with community-based organizations and local communities to co-develop interventions, which is giving information is not enough. If people, for instance, are dependent on food support, well, they can't wait in a line in a sort of food aid agency to get food when there's wildfire smoke or heat. So we need to be proactive and work on not just the information, but the resources to enable people to be safe.
All right, thanks, Sherry. Our healthcare systems are not prepared to deliver healthcare in general, I would say, but that's me, just my opinion. Mike, I want to hop to you here. And what you look at climate impacts, and it's forcing people to move. And I'm playing the blame game here a little bit, but which institutions are least prepared to respond? And I guess it even depends on impacts. We keep going back to the LA fires, these huge things, but I'm originally from Florida. My son dealt with 2 hurricanes in back-to-back years. And so maybe some institutions do well based on the climate impact, but just kind of walk us through that.
Well, I guess first and foremost, disasters are approximate, are local. The impacts are largely felt locally at the neighborhood scale, at the community and community-wide scale. So unfortunately, many of our communities, as we saw from the Los Angeles fires, even in a city of 4 million and then about 10 million in LA County, was not adequately prepared for the magnitude of destruction or the needed evacuation. So when you tailor that down a little bit at the neighborhood level, we hear stories of people that were disabled and elderly, those that were dependent on medical devices that were stuck in home care homes and other places and were not evacuated for hours, and sort of the impacts that happened there. And if we look at the population that Primi and I work with, it's obviously looking at the county, how the county governments have not, for the most part, really addressed the needs of a diverse population, both culturally and linguistically. As Primi mentioned, up until 2017, everyone thinks of California being very progressive, this Latinization of the state. But during the 2017 fires in Ventura and Santa Barbara counties, there was no live interpreters or translators of emergency information during that time. They had to get positions, a lend from Sacramento from the State Office of Emergency Services, because the county had not had a full-time staff person dedicated to that. So that has changed over the years, but there's still places in California that we see this gross inequity that create disaster plans or systems that are not culturally or linguistically appropriate. And again, Sherry, Primitiva, and others have brought up this idea of a community-centered approach to disaster preparedness. The research time and time again over the last couple of decades, this is nothing new, has shown those communities that have been involved in the disaster planning, the disaster plans themselves, are often the ones that are able to withstand the most drastic impacts, or are able to recover in a more speedy and equitable fashion. But I think Primitiva also had her hand up. I don't know to add in as well.
And I got a question from the audience for Primitiva too, but I don't know if you want to add to what Mike just said there, Primitiva, but I was going to get.
Yes, and my question was for Ali, because a pattern that I'm noticing here is like this communication, these tools that are being developed, and how can NGOs such as 805 and DocuFund utilize them. But there's what we're going through as a country, the current political climate, the breaches in privacy, and how can this data, these tools, sort of safeguard for privacy, data privacy, because the communities that I represent, data has been weaponized to track them. So even if, for example, NGOs as 805 learned how, I don't know that we would want to without those safeguards, ensuring that the communities that represent will not be tracked, that we use data to plan for resources, but not to track people and their movements and where they are. That's going to be a huge issue that we're going to need to face as a society that heavily relies on data, and how that has been weaponized for the communities that I represent.
Yeah, absolutely. That's why one of the most important aspects of leveraging data and AI for disaster management is a responsible data and a responsible AI practice, which involves addressing issues around fairness, privacy, accountability, etc. So the data sets I was talking about are not tracking individuals, but mainly these are anonymized, aggregated at the neighborhood scale that can only determine evacuation behavior. So they're not capturing, or tracking people's movement, but seeing based on patterns of activities for a community as a whole. Is there an uptake in evacuation behavior in that community, in that neighborhood, which enables a privacy protected way of analyzing the evacuation behaviors. And also another aspect which is equally important than privacy is also fairness and bias in the data set. So one of the important aspects that any tool or any data sets that are created in disaster response and emergency management space needs to consider is that most of the data sets have some sort of imbalance or bias. So models can exacerbate these biases and imbalances, and there are techniques to address those. And there is a growing body of literature around, fairness in AI that addresses issues around fairness, not just, again, generative models, but also even tabular data and predictive analytics, so that when, for example, a model predicts certain areas with evacuation levels, does not underestimate evacuations in a low-income neighborhood compared to a higher-income neighborhood. And all these issues and challenges have been widely addressed by the research community, including the work of our research group.
All right, Prima-Team, I'm going to ask you a question. You just asked Ali a question. I just wanted to look at the Q&A, and you just asked the question: how do we ensure that the data Ali is discussing isn't used to harm, detain, otherwise exclude vulnerable people? And I just thought it was appropriate that person, anonymous attendee, asked that question. So you basically asked the same question. So we'll let you do that. I want to ask this question from Melissa Boudry. But it's for you, Primitiva. How can local emergency management organizations coordinate proactively with advocacy agencies and organizations like yours who have the established relationships with undocumented individuals and migrants to ensure that those populations are accounted for in emergency planning efforts, particularly when it comes to preparedness for evacuation, mass care, and sheltering? You've sort of answered some of this, but just more broadly, it seems to get to the heart of what you do there. How can these local emergency management do better?
I would say, alluding back to Professor Mendes, is recognizing that if we prepare at the local level, what research has proven that those plans that involve the community are better equipped to prepare and to recover. Unfortunately, the reality of the current climate right now is that organizations like ours are facing some of that harmful rhetoric against the immigrant community. I am part of many groups where this has been our struggle for many years, how to create those bridges, and we were making progress. That some of the progress now has been stalled or lost because government entities themselves right now are afraid to work with NGOs that serve the immigrant community. They want to cover or be perceived as not, equity is a word that is like a taboo word, sanctuary, immigrant, undocumented. So it's gonna take years for us to undo the level of harm that has been done by the unjust persecution of the immigrant community as a blanket, as an entire community used as a political pawns. And I'm not someone that brings in politics, but that is the reality of things right now. And we are seeing it at the city level, at the local level, when we should be talking more, figuring out how to create stronger bridges. We're not. And it's not that the will isn't on the side of NGOs, it's on the other side, putting it plain and simple. And it's going to take us years to recover from this level of harm.
Yes, I'm sure in what you do, it's very difficult to keep politics out of what you do, and I'm sure that you try your best. And I just want to do a check-in here. We're almost up. I'm going to probably get through just about everybody for one more question or one more comment, but we've probably got another 6-7 minutes before we're going to wrap up with Julianne and just close this thing out. But Mike, I'm going to jump to you here. So in California, was going to change one thing in the next 2 years to better handle climate mobility and these issues here. What should that focus on first?
That's a big question. There's so many. So as the various panelists were mentioning, here in California, we're at the forefront of climate change. Between California, Texas, and Florida, we're probably and Puerto Rico, probably the states and territories that experience the most climate change, and having the largest population. So what we're experiencing, seeing over the last couple of years and in the future, is this the great California climate displacement of people, regardless of their socioeconomic status, and obviously those with the less resources, those that don't have the privilege of being a legal status are going to be more displaced and suffer more costs. And research has shown over the years, low-income people, particularly African Americans and people of color, because of our discriminatory disaster policies, both at the federal and state level, that over the years they're not able to be resilient and bounce back. And there has been significant loss of household wealth because of that, from generation to generation, and that those inequitable disaster policies have real life implications over their life course and the subsequent generations, particularly for people of color. And so what we really do need, particularly with this federal devolution of responsibility of FEMA and less resources going out to states are going to have to plan and unfortunately going to have to find more funding from their ever decreasing source of funds. California's in a major budget deficit of how they're going to backfill these issues when the federal government are not going to do that. So that it's going to take more innovative policies, the state coordinating with county and city governments more about how they can better prepare communities and again take this community-centered approach. So Governor Gavin Newsom has had some excellent grants through Cal OES, that's the State Office of Emergency Services, and a program specifically called Listos Campaign, which initially started as an earthquake campaign for largely Spanish-speaking people, but that has morphed into a larger campaign for hard-to-reach populations. So for me, that would be a priority to fully fund the Listos campaign that has some success there, but is still underfunded.
All right, Sherry, I'm going to jump to you, and we are down to like the last minute, but if you can kind of give your final thoughts. There's a lot more questions asked about, public health and all these issues, but sort of final thoughts you'd like to leave to the audience.
Yeah. So what I would say is if we're thinking about how health systems need to adapt, we need to redesign our systems to function under uncertainty, including patient-related mobility. So most of our systems now are built around steady utilization, but we need to figure out how to handle change. We need to handle episodic surges in healthcare demand, so stronger surge planning. We need better coordination across jurisdictions and also flexible staffing to function under conditions of climate hazards and migration. One thing that hasn't been mentioned as much, I saw in one of the Q&As, is just workforce and the fact that health providers are affected by the same climate pressures as others. So planning for backup workforce is very critical. And then I think just really emphasizing using data, and we actually now have a climate and health data dashboard for California that can be used by policymakers and community members to really identify who is at risk before the exposure and intervene early. And then we need to be planning for the infrastructure and operational challenges as well. And the final thing I'll say is that we need to be better preparing the current and future healthcare workforce to face climate and health threats. So most health professionals do not receive training on climate and health. We've been working very hard on this for many years. So for instance, we have free educational content on climate and health that we distribute through the American Medical Association Education Hub. So that training is freely accessible to over 270,000 health providers, and really important to really train not just doctors and nurses, but also mental health providers on this. And I'll stop there.
All right, thanks. Ali, I'm going to jump to you and just, I guess kind of briefly, if it's final thoughts for folks, if they want to learn more about what you're up to.
Absolutely. So I would leave the audience with something to think about. We see AI and data as additional defense barriers for communities facing, climate challenges and climate impacts by increasing, ability to better predict and anticipate these hazards and also monitor situations during and in the aftermath. So I think there is an opportunity for building these capacities within communities at all levels to bring these resources into the processes of emergency management.
Great, thanks, Primitiva. And we're at the end here, but any final thoughts? Anything, if people want to go visit your website, learn more about what you're up to?
I would say just a big takeaway is that California needs to figure out how to move beyond temporary fixes. Climate migration is already here, and establishing equitable processes isn't an optional. If we want to be a state that truly reflects the communities that make California the fourth economy in the world. And if you want to learn how to get involved, going to 805ondocufund.org. There is a lot of work that we're doing not only at the regional level in the Central Coast, but also at the state level through our California Undocufund network. That's 805ondocufund.org.
Fantastic. We'll have links to all this, and this will be a YouTube video. So panel, thank you so much. Thanks for your contributing today. And I'm going to get it back to Julie Ann. And this is the final one. And I appreciate the organizers inviting me to be part of this process. But Julie Ann, over to you.
Thank you so much, Doug. And thank you to our outstanding panelists. Doug, our talented moderator for the fourth time in a row now. Thank you, truly. As well as the dedicated staff from all three organizations who made today's program possible. Most of all, thank you to the hundreds of participants who joined us. Your thoughtful questions, including many from state agencies, made this discussion even more valuable. So a recording of this briefing will be available on our website, so you can revisit it or share it with colleagues at any time. And if you haven't already, be sure to sign up for our newsletter. We are at ccst.us, so you don't miss any updates. Thank you again. And with that, we will conclude our webinar, conclude this series. Once again,